Hello, I'm Dr. Herman, and I want to share with you an update, an amazing update with a patient of mine. And there's two sisters here. This is Enid and Vic Marie. Vic Marie she understands English but speaks Spanish, so we're going to hear both in Spanish and English, and we'll help translate. But this is too important to not share at this point in her progress of what's going on with her under my care. Can I just let you tell about it, or should I ask some questions to share?
Yeah, ask some questions.
Because there was really, Vic Marie, who lives over in Puerto Rico, she has a bone disease, and I've written about this before on Facebook. She has a bone disease called anisopoikilocytosis, which is a rare blood disorder where they see the red blood cells are all different sizes and shapes, and her hemoglobin can never become stable with the care that they're providing her. Even though we don't see an improvement there yet, we've only had 2 treatments, but there are dramatic improvements in all other parts of her body so far. Mm-hmm. And we are going to report again. Let me just say this before we get into some description of what's going on for her. We will report again as she does show on the laboratories that she does not need a bone marrow biopsy and that she will stabilize her hemoglobin with this work, with everything that we're finding with my work. So, your pain was on the side of your face. It was the whole mouth, it was the face, and it was the side of the head, right?
Yes.
Yes. And your chronic fatigue was, it was just incredible. You had barely any energy to get out of bed?
Yes, she couldn't get out of bed. She was most of the day in bed.
Most of the day in
daily,
bed.
Weekly.
Yeah.
Never
Walking
energy
a
to
distance
walk.
was, no,
No.
there was none. Now she's able to walk
1 mile.
1
so
mile,
far,
she's able to walk with energy
with
Yeah.
energy.
and able to get right up out of the bed.
Yes.
There has been, with the face pain that you had, on a severity scale of 1 to 10, 10 would be the worst. And it was all around the mouth, the side of the face, and the side of the head here. That pain, on a scale of 1 to 10, if 10 was the worst, how would you rate that pain?
¿Cómo lo siento ahora?
Sí, que de 1 a 10, ¿que cuánto es el dolor ahora?
Como un 3. 3.
She says 3.
Now it's a 3.
Yes.
3.
What was it before?
Oof.
Above
Maybe
10.
11.
Above a 10.
Above the 10.
And with the kind of pain, it was dull, it was stabbing, it was shooting, it was burning. How would you describe it?
Electric. All
Electric
down.
shocks all
Electric
over
shocks.
there.
Electric shocks on the side of her head and face.
Yes.
Did it go into the eye?
Yes.
Yes. It was constant.
Mm.
All day, all night. You even had terrible insomnia.
Yeah.
Terrible. And you could only sleep how many hours a night? Back then, before?
Antes 2 horas.
2 hours.
Maybe
time.
2 hours a night.
Yes.
And now?
Más de 5, 6.
5, 6, 7, sometimes
5, 6, 7, 8 hours now at night.
Mm.
Amazing.
Yeah.
The swelling that you also had around the neck and the face, that was, and you can say,
It's
what you even told me
decreased.
today,
Yeah,
it's decreased.
completely decreased.
It's almost like the face was almost double the size.
Right.
And now it's come down dramatically
Yes.
in 2 sessions. Have there been any other therapies that were offered to her besides coming here? And I don't mean about a bone marrow biopsy or a blood test to see what her levels are in the blood. Have you done any other methods of therapies or treatments besides this right now?
No.
Following every step that you
Following
given
what
us,
we're doing.
Yes.
And we haven't even done, we did find infection in the mouth, but we haven't even gone that route with the dentist yet to get rid of that. And the face pain is
Gone.
almost completely gone.
Mhm.
Amazing, yes? The bloating you had, how bad was that? That was an everyday, every night bloating in the abdomen,
La barriga la tenía siempre inflada.
Sí. All the time.
all the time?
Yes.
You do speak some English.
Yeah.
Okay. And a little nervous in front of the camera here. And there was also an intestinal problem where you weren't able to go to the bathroom every day.
No.
So how many days a week were you able to actually, the constipation was so bad that was it once a week or once every 2 days? How often was it
¿Cuántas veces
then?
al año, anterior a esto?
Wow. 2 días, puede ser 2 días sí, 3 no.
2 días, 2 days she could go, and then 3 days she wouldn't. And it wasn't daily.
It wasn't daily.
No.
So maybe 2 days she would go, and maybe she'd have
Yeah.
2 or 3 days in
Yeah.
between she'd be able to go to the bathroom.
Right.
Now,
All
No.
the time.
all the time. Now you're going more than once a day.
Yeah.
And it's cleaning out.
Right. Yeah.
Mhm.
That's
cleaning out.
awesome. Awesome. So the energy is dramatically improved. The face pain is dramatically decreased.
Yes.
The
And
medication she's not taking. as
medication she's not taking at all.
much. Neurostine. She was taking
Just
Neurostine
one.
for the shooting of the pain in the head.
And did that medication that she take ever helped her reduce the pain?
It reduced the shooting. a
Okay.
little bit, but now
Mhm.
she's not taking it as much.
Was that a
Not taking-
steroid or was that, what was that?
It's a
Some kind of pain
Neurostim.
reliever?
What's it?
El
¿Para qué es esa medicina?
Neurostim, para el dolor neurológico. El dolor
Neurological
que-
pain.
Okay, so
Neurological
there was some
pain.
nerve pain pill.
Nerve
Yes.
pain.
And it never really didn't do much for it. It decreased a little, but didn't take it away.
It will come back.
Mhm.
It will
And now
come
we're seeing a
back.
dramatic decrease.
Después de las 8 horas o 6 horas, 5 horas, volvía
Yeah.
y no se iba completo.
Anything else that you want to share of the improvement so far? Just a little nervous? Anything else that you can say for her of what you've witnessed here?
Yeah, no, the energy that she has now, that she's able to get up and do things.
Mhm.
She's happier. She's more willing.
More willing.
More. The body's responding to the treatment,
Yeah.
so that she's able to do a lot more.
Is this something that was easily understandable for you when we first got started?
Oh my
You know,
God,
what
no.
I'm offering?
Mm-mm.
It was a very
Yeah,
strange.
they're very strange method of medicine that is very hard to explain.
Yeah.
And so whenever I had someone who asked what it is about, and I'm like, I will have to send you some information online,
Yeah.
or maybe you can talk to the doctor, or
It's a bit difficult to get across, but you're seeing just dramatic changes for her in a short
Yeah,
time
it's-
without too much work too. Without too
Yeah.
much work, and there's no medication. So I'm going to share as we move along with her program, and we do see, because right now, 2 months into this, she just had another bone marrow biopsy and had a blood test, and we don't see yet the hemoglobin looking better. We don't see the bone marrow looking better according to what the doctors are doing, but the energy is way up, which is amazing, because in order for you to have better cellular function in the body, you got to be able to get the energy up for the body to be able to heal itself. I'm going to cut this video here, but I'm going to make another video privately here where I'll share some of the findings of her first 2 exams and why she's making such dramatic recovery and reduction in pain and improvement in energy. But today's exam, we did find in the hemoglobin that it is going to start getting cleaned out. The body was not ready for hemoglobin or any major bone marrow repair in the first 2 visits. We can't step on the toes of the patient. We got to let the patient's body dictate what it's ready for and when it's ready for that. Otherwise, we can have rejection of these treatments. But we are pretty happy with where we're going so far.
Yes.
And I do expect, just so you know, you hear my word, I do expect to see that hemoglobin get to a normal level, and I expect to see it stabilize for you. And I see that their bone marrow biopsies one day are going to tell them that your condition just, they don't see any need for the bone marrow transplant. And that was their recommendation, was a bone marrow transplant.
oh my God, yes.
And it still is their
It
recommendation.
still is. We're still waiting for
And-
the doctors from the
Yeah,
from the other
from the different hospitals
Right.
and so on. But right now you feel like you're
We'll
just
hold
going
off
to
on that.
hold off on that for a little bit. And I'm not telling her not to do the bone marrow biopsy, but they're seeing improvement. So we really think that we can help her beat this condition and no need for the biopsy. Okay, we'll check back in again. Thank you, girls, for helping me share
Yes.
this with everybody.
Thank you.
And
Thank
you can
you.
call my office, 954-370-3100, and always click subscribe on the YouTube channel. I'm always putting up great information here to help you see that you can reverse these degenerative diseases in the body. Thank you.